Welcome to Reducing Anxiety During Disasters. What you need to know. Hi, I'm Jessica. I'm an American Asian woman with long dark hair wearing purple glasses. I use she, her pronouns. I'm an accessibility consultant and advocate. I have several disabilities and I experience significant anxiety. I am here to talk to you about what people with disabilities need to know about reducing anxiety in disasters. We are not doctors, therapists, or healthcare providers. If you need medical advice, please contact your healthcare provider. This training is not intended to be medical advice. In this training, you will learn what anxiety is, ways to reduce anxiety during disasters, actions you can take to reduce anxiety through preparation, ways to build support networks to help you in a disaster, and some advocacy strategies that can reduce anxiety. First, let's make sure we all have the same definition of anxiety. If you are experiencing difficulty breathing and chest pain, you should call a doctor to make sure it is not something more serious. Anxiety can look differently depending on the person, place, or situation. Sometimes you might feel anxiety in a situation, but in the same situation at a different time, you might not feel anxiety. One time you may feel less or more anxious, or you might feel very nervous. Another time you might feel cranky or angry. One person might feel nervous and want to pace one day, but want to be by themselves another day. It's important to remember that anxiety isn't just one thing, it shows in many ways. Some signs of anxiety can be feeling extremely overwhelmed, nervous, scared, like something bad might happen, out of control, angry or irritable. Other signs are difficulty sleeping, eating more or less than usual. You can tell the difference between anxiety and everyday emotion because anxiety is intense, feels uncontrolled, and happens often. Anxiety can feel like a pit in your stomach or a worry that won't go away. It is okay to feel anxiety, even when a disaster does not happen. Most people are anxious at least sometimes. Almost everyone feels anxiety during disasters. Anxiety can be because of not knowing about the state of your home, equipment, medication, or important documents, where you will be living, how you can maintain your health, or the future in general. People with disabilities have good reasons to feel anxious. Due to the stress of living with a disability, an example, lack of accommodations, people with disabilities may experience mental health conditions such as depression and anxiety. Disabled people may feel more anxiety during disasters for many reasons. Some reasons include being separated from family and friends, personal assistance, equipment, medication, specific foods you must eat, or your home and other familiar places. Many people are anxious about getting vaccines. That doesn't mean you can't get them. Actions you can take to get vaccines when you have a fear of needles. Bring someone you trust with you. If they can't come in person, maybe they can be with you over the phone or FaceTime. If you have a doctor that you trust, ask them if they can give you the vaccine. Deep breathing. There are actions that you can take to prevent or reduce your anxiety. We are going to look at them now. Here are some actions you can take to address your anxiety. Identify what makes you anxious if you can. Do the most important tasks first and know that you can't do everything at once. Make a schedule. Listen to music. Read. Write or keep a journal. Talk to friends or family members. Ask for help. Here are more actions you can take to address your anxiety. Exercise as recommended by a medical professional. Walk or roll around. Gentle stretching. Meditate. Breathe deeply. Talk with others. Other ideas are use fidget devices or toys, or go to a quiet space. Your daily routine will change when a disaster happens. As much as possible, it is important that you try to keep your routine and do things that make you feel good. Some actions you can take to address your anxiety when a disaster has happened. Use tools to lessen anxiety that were mentioned previously. Keep your routine. Prepare for disasters ahead of time. Practice advocacy strategies. Learn about resources for people with disabilities. Learn your rights. Our daily routines can be a big part of what keeps our anxiety under control. When a disaster happens, keep as much of your daily routine as possible. Don't forget to take your medications as prescribed. Drink plenty of fluids, try to get enough sleep, and eat as well as you can. Some actions you can take to reduce anxiety during and after disasters are making a list of actions that you already know helps reduce your anxiety, planning how these can be done or be done in a different way after a disaster. Here are some examples of changes to activities that reduce anxiety. Walk inside instead of outside. Consider chair exercises or gentle stretching instead of exercising in a larger space, like a gym. Sing songs or hum to yourself or play them in your head if you don't have access to music. You can take control, reduce anxiety, and empower yourself by taking these actions. Preparing ahead of time by knowing your needs and your rights. Deciding who is part of your disaster support network. A support network is a group of people who can help you stay independent. Connecting with your support network before a disaster. Putting together a bag with important documents, extra medications if possible, and other items. Learning where you would find information on where to go and how to get there if a disaster happens and you need to evacuate. Helping yourself and others if you can. Helping others can give you a sense of purpose, control, and empowerment. Support can reduce anxiety in disasters. People can help you by providing things and services like transportation, equipment, and personal assistance. People can also help you by talking to you and giving advice, listening to you, and brainstorming with you. Disabled people can get support from friends and family, other disabled people, organizations led by people with disabilities, and organizations that provide services to people with disabilities. Think about the people that have helped you in the past during disasters or emergencies, including personal emergencies. Here are some actions you can take to make sure people are able to help you in a disaster or emergency. Make a list of all the people that said they could help you during a disaster and others who you think might be helpful. Contact those people and ask if they would be willing to help again. Get together with those people virtually or in person to figure out who can do what and who will be backups. Peer support may also be helpful when you experience anxiety during disasters. Peer support is when people with disabilities use their own experiences to help each other. Connecting with peers can make you feel less lonely, help you manage anxiety and depression, connect you with resources, and support you in problem solving and dealing with new situations and places. You can find peer support programs through your local Center for Independent Living. Center for Independent Living is a disability-led organization that helps disabled people live independently in their own homes. And in some states, mental health providers may have peer support specialists. In a disaster, you may not always be able to get everything you need. Advocacy is deciding what is most important to you and working with others to make it happen. By advocating for yourself and others, you are more likely to get what you need and protect your rights. Advocating for your rights may reduce anxiety. One way of advocating during a disaster is communicating your needs to others. Communication is telling someone what you need. You can communicate by speaking, writing, using a device, or by pointing, moving around, or making faces with body language. Some devices are called augmentative and alternative communication, or AAC devices. These are tools that help a person communicate. They include phones, tablets, and communication boards with pictures and letters. Sometimes just saying, writing, or expressing how you feel can reduce anxiety. Telling staff or volunteers what you need is important and can help reduce your anxiety. And if you don't understand what the staff or volunteer is saying, make sure you ask questions. Learning to advocate for your rights and the rights of others can also help reduce anxiety. Communicating your needs to public health staff, healthcare providers, and volunteers before a disaster or emergency happens is helpful in getting your needs met. It is also important for disabled people to be involved in planning before a disaster or emergency happens and to build relationships with public health and emergency management departments. You can start now. You can go to public health meetings and talk about what you need as a person with a disability. This will help create policies that are helpful to people with disabilities. Policies are plans to do something that a government agency, organization, or other group agrees upon beforehand. If you don't know how to get involved with public health, Centers for Independent Living should be able to give you details. A way to reduce anxiety is by advocating for yourself before, during, and after a disaster or emergency. You can advocate before a disaster by working with public health staff to create policies that are helpful to people with disabilities. You can advocate after a disaster by communicating your needs and what you have learned to your community. You can start with your support network. In this video, we have looked at what anxiety is, ways to reduce anxiety during disasters, actions you can take to reduce anxiety through preparation, ways to build support networks to help you in a disaster, and some advocacy strategies that can reduce anxiety. Thank you for joining us. We hope this will help you reduce anxiety in yourself and others during disasters. This video was provided by the World Institute on Disability, thanks to the Centers for Disease Control Foundation. Video content ideas, a glossary of the terms we used, and some places you can get more information are provided at the link below the video.